Welcome to the second meeting of the Equal Access Book Club. Today we'll be discussing Chapter 2, Disability Law and the Process for Determining Whether a Student has a Disability. When the Guide to Assisting Students with Disabilities, Equal Access in Health, Science, and Professional Education was first published in 2015, it filled a gap for those of us involved with the education of students with disabilities in the health sciences. Since then, much more has been written about students with disabilities, accommodations, and ways of thinking about disability as diversity. And the new edition of the book, which we're covering in this book club, has provided us with additional up-to-date and truly useful information.
Moreover, with leadership and organizations like AHEAD and the Coalition for Disability Access in Health Science Education, communities of disability resource professionals are able to better learn from one another. The publication of this second edition, now named Equal Access for Students with Disabilities, the Guide for Health Science and Professional Education, builds on the first edition while being informed of the tremendous amount of thinking, writing, and research that has emerged over the last several years.
In this second of 11 monthly meetings covering the main chapters in the Equal Access book, we'll dive into the book and learn more from each other. Before we get started, let us tell you a little bit about ourselves. I'm Charlotte O'Connor, and I'm the Learning and Disability Specialist at the University of Michigan Medical School. I've worked in higher ed for close to 20 years as an instructor, an academic coach, learning specialist, and also a disability resource provider. I've worked closely with students in a variety of fields. In my experience, health sciences programs are absolutely the most challenging for students, and working with this population requires highly specialized knowledge. Despite my experience, I could not have survived the past 3 years in my position without the support of AHEAD, the Coalition of Disability Access and Health Science Education, and the peers, especially Lisa Meeks, that I've met in this field. It truly takes a village, and we're so happy that you share this sentiment and are attending this book club meeting.
And Charlotte, I'm so glad to be part of your team at the University of Michigan. I am Lisa Meeks, and I am one of the editors of this new book. And I work in family medicine as an assistant research professor.
The second edition of the book, Equal Access for Students with Disabilities, would not exist without the fantastic editors, Lisa Meeks, Neera Jain, and Elisa Laird. And there are many others who've contributed to this book, and we're grateful to all of the authors who are listed on this slide.
And this Equal Access Book Club series would not exist without the support of key groups, including AHEAD, the Association on Higher Education and Disability, and their assistance with the Zoom platform. Everything has been, they're always invaluable partners. The Coalition, and designated interpreters. And of course, our publisher, Springer. We're grateful for everyone's support of this pandemic year to explore the second edition together. And I do want to mention that the speaker and presenter from the first book club, Dr. Joe Murray, is also on the call with us today, and he will be helping you navigate the hand raising and the engagement with the conversation.
Okay, some guidelines for today's book club discussion. As moderators, our roles are to pose questions based on the second chapter of the book, Disability Law, and to facilitate a discussion among all of you. Please be civil and respectful and encourage participation and support for each other as we navigate the multiple perspectives of our audience so we can learn from one another and grow as a community. The best way to engage in the discussion on Zoom is by using the raise hand function. If you do that, you'll be called on and you can and you'll be unmuted so you can speak. If you do not want to raise your hand, another option is to pose a comment in the chat function. Questions to the moderators can be placed in the Q&A feature.
So we really want to hear from you. We want you to participate. So whether that's participating through the Q&A or participating by raising your hand, We are simply the moderators. And one announcement that I want to make really clear is that I am not an attorney. Charlotte is not an attorney. We are not attorneys, and this is not legal advice. We are simply moderating the chapter. We're not even the authors on this chapter, but we're here today to moderate with you. One reason that we chose not to necessarily have the authors of the chapter serve as moderators was so that we could really engage in conversation. This is not intended to be a didactic presentation to you. It is truly intended to try to mimic a book club minus the, nighttime snacks and wine, but we really want you to engage. To encourage that engagement, we are actually going to do a drawing for the book. And the way that we're going to do this is every time somebody participates. So whether you raise your hand and say something aloud, or whether you type in the Q&A, we're going to jot down your name. At the end of this series, we're going to pull a name out of a hat and someone will win a free book.
Okay, let's jump right in with question number 1. To better understand the history and evolution of societal perceptions of disability, describe the difference between the medical and social models of disability.
All right, who wants to jump in here? I'm seeing some pretty famous names who I know can answer this question on this participation list. All right, Laura Bulk has raised her hand. Joe, can you?
All right.
Laura, you know it's talking to you.
Can you hear me?
Yes.
All right, great to hear your voices. Okay, so if I have an hour, it's a different answer, but in the 60-second version, to better understand the history and evolution of societal perceptions of disability, describe the difference between the medical and social models. So in the medical model, which I sometimes refer to as an individual model as well, disability is really framed as a deficit and something in need of treatment, rehab, or cure, something that we would definitely consider a tragedy and that we would not want. And it is really something that resides within the individual. Whereas with the various social models of disability, disability is no longer framed as something that is just an individual experience. It is framed as something that resides within our society at various levels. And the challenges that we as disabled folks face are no longer because we have a deficit, but rather our society has some deficits and is not designed for the widest possible variation of human experience. Okay, maybe it was more than 60 seconds, but there we go.
Laura, you are such a gem. Thank you so much for being the first person to participate today. And for those of you who do not know who Laura Bulk is, give her a little Google and Google Scholar and read some of her work. She is amazing. And I'm a huge Laura Bulk fan. So I'm just humbled to have you here with us today.
The feeling is mutual.
Well, let's move on to question 2. I noticed there were no other hands raised, and I know we have lots of questions to cover today. So be thinking about who's going to raise their hand next. And the question is, how is disability defined by the ADA? And then a sub question of that is, how did the ADA Amendments Act of 2008 expand the definition of disability? What are some major life activities that were newly covered as a result of this amendment? Who wants to jump in? The good news is I see people I know, so I'm very famous for volunteering people to talk.
Lisa, were you able to advance the slide?
Oh, so sorry. Anybody want to jump in? Any comments in the Q&A, Joe?
Nothing that I can see right now.
All right, Maria Keller, thank you so much. Maria is one of my UC sisters. All right, Maria, can you give Maria access to speak?
Maria, can you speak?
I believe I can.
Awesome.
Yay. So, straight from the book. The ADA defines disability as a physical or mental impairment that substantially limits one or more major life activities, a record of such an impairment, or being regarded as having such an impairment. How did it expand it? It included chronic health conditions more than anything else, temporary disabilities. I don't remember where I saw that in the book, but I mean, my understanding of it is that it expanded it to more than just limiting it to the medical model perspective, and more of like, what are the impairments that are going on, and how is that disability, and how is that attached to a current disability?
Great.
Cancer,
Anybody want to talk
Crohn's.
about? Yeah.
Sorry.
Oh, sorry, Maria.
I
Go
was
ahead.
saying things like cancer, Crohn's, things that may not be actively impairing an individual, but is subjected to flare-ups, was also, I think, one of the major contributions to the 2008 amendment.
Wonderful. Anybody else want to jump in?
A record of, regarded as, those kind of things.
And this is Charlotte, and I was always kind of thrown by that, a person who is perceived by others. And so I'm wondering if anyone would like to go into that for people like myself who were confused at one time.
Great, Paula. Joe, can you unmute Paula?
Hey
Paula,
there. Yeah, can you hear me?
Yes.
So my understanding of the regarded as is any condition or disability that or having being perceived as a disability. So something like having a history of seizures, for example, might not currently be active, might not currently be in play, but because of the history with a given condition, you are presumed to have limitations, disability related limitations based on that perception. So when I've looked at, in some of my research, when I've looked at some of the court cases, you look at things like people who disclose having seizures in childhood and now are employed and are being discriminated against because they're concerned that there will be a seizure while working with children or something like that. So that's my understanding. I'm sure somebody else can clarify a bit more.
Thank you. That's great. Anybody else want to jump in?
Lisa, one of the participants, Marie Lusk, shared with us just some things for us to think about. That disability includes major life activities, including things like eating, breathing, sleeping, concentrating, thinking, lifting, bending, to name a few, and to think about it as encompassing the entire body and all functions, including digestive and endocrine, for example.
Thank you, Becky.
That was Marie Lusk.
Marie Lusk. Yes, her nickname is Becky.
That's confusing to me, Lisa.
It's for those of you who know Beyonce, Becky with the good hair. That's
Hi, Becky.
Marie Lusk. She has Becky with the good hair. So her nickname is Becky. She's gonna kill me. But thank you so much, Marie. All right. Let's see. Charlotte, you want to go over question 3?
Certainly. A number of local, state, and federal laws govern disability protections in the United States. Beyond federal laws that apply nationally, how would you go about learning about any additional laws your institution needs to abide by to ensure full compliance?
Great, Brian. Hey, Brian. Joe, can you let Brian?
Brian, can you talk?
Can you hear me now?
Yes,
hear
sir.
ya.
So when I moved to Nevada, I met with our general counsel and we reviewed the state regulations. It's called the NRS in our state to understand the state level protections for disability. The most important one for us is that service animals in training have the same rights as service animals under the state law, even though they don't under the federal definition.
That's a great example. It's a great example. How is everyone finding out about their state laws? I know that there are some differences as well in California. How is everyone going about getting their legal updates? Are people attending Paul's training or the AHEAD yearly update, or are you reading your disability compliance? What is your biggest source of legal information? Is it Dina or Dinah? Joe, if you want to unmute.
Hello.
Dina,
Hello,
able to speak?
it's Dina.
Dina, hi Dina.
Hi, I work with Brian.
Oh, great. And thank you, Brian, for your, thank you so much for raising your hand.
A couple of ways that we stay informed is through AHEAD, but also through the local chapter of Nevada AHEAD. And we have OCR presentations at least annually, sometimes twice a year, to help us with staying abreast of what's going on in disability law.
That's an excellent idea. Do they charge you to come out and do that presentation?
They do not.
Ah, does everybody hear that? I was just on the phone earlier today in a mentoring meeting. AHEAD has these amazing mentor groups. And one of the things that the co-facilitator was saying is that when he gets into a complex case, he actually picks up the phone and calls his local OCR office. And people are always so afraid of OCR. And I have never been. I see them as partners in helping us do the right thing. So it's really great to hear that. I've never had them come out and do training, but it's great to hear that they're doing that as well.
Mm-hmm. They do, and it's very helpful. As a matter of fact, in terms of contacting OCR, I was talking with a colleague at a different university here in Nevada just this morning, and she and I decided that the question required at least an email to the OCR representative we usually have out.
I think that is, everybody got their bang for buck with your comment today. That is like, that's going to be the winner chicken dinner of this book club, because what I envision, even though we all can't see each other, is that right now everybody's making a note to themselves to contact OCR and see if they can come and do a training. And what I would encourage you to do, if you're in a geographic region where there are other schools in close proximity, is to see if you can partner with your geographically, at least near peers, and have OCR come out and give a presentation to everyone. It's a great way to meet people that are in the quote unquote in the biz in your area, but it's also a wonderful way to, have OCR get some bang for buck for their time. And the not charging, I mean, we're all under budget constraints. So this is a perfect professional development opportunity. Thank you so much for contributing that. I appreciate it.
You're welcome.
Lisa, there's lots of comments that were directed to panelists in here. And I think maybe one limitation in the Zoom is that people can only direct to us and not to each other in the chat. There's about 7 of them. And I just want to read a few of them just because I won't cite everybody's names, but just so you're other people might benefit from some of these. Some mentioned just staying in close contact with AHEAD. Some mentioned staying in close contact with Lisa Meeks, specific trainings and disability compliance. Nellie, Nelli, AHEAD, DOJ updates, EEO updates, Salome Hayward webinars.
Salome Hayward.
Salome.
Yeah. Mhm.
You could tell I'm an opera fan because that's Salome to me. Let's see, there's a few others. Updates by Paul Grossman, Hayward Legal and other disability law legal updates. Brian Hilbert shared a free ADA advice line. I'll share that number with people. It's 1-800-514-0301. I'll say it again, a free ADA advice line, 1-800-514-0301. If people do have things that you think you'd like to share with the group rather than us read them to the group, you may be able to post to everyone, to panelists and attendees, and that would be great. If you'd rather just still direct them to us, we can try to read them as we see them.
Okay, I have to make a comment because you guys know how much I love the disability professional community and the AHEAD community and coalition community. And this is just evidence of, this book club is this idea of kind of crowdsourcing knowledge, right? And making it free and accessible to everybody. But I sit here and I look at all of these posts and I think, Brian Hilbert, for example, first of all, Nevada for the win. And I had no idea there was a free ADA advice line. I wrote this book, I had no idea. I wish I would have known about that resource to put it in. But these are things that are going to help me do my job better. And then Tanya, the minute, Joe offers that people are having difficulty saying things to just the panelists versus attendees, Tanya pipes in and says, hey, this is how you do it. Everybody is it's just such a great community. And it is such a great community that kind of wraps their arms around one another and supports each other with resources. And that's always clear in all of my exchanges with people in the disability resource community. But I think it's funny that it's even evidenced and kind of coming through when we're doing this virtual book club. So kudos to all of you. You're amazing. And it's late on a Friday and everybody is still here and committed to sharing this information. So I appreciate all of you. So I will go to question 4. And that is, institutions are responsible for making internal complaint grievance procedures easily available and accessible to students. What should be included in this procedure and when might it be used by a student with a disability? So I know we've got a lot of attendees and a lot of people who still have room to contribute. Remember, you can contribute if you're not a big talker, you can type it into the chat or into the Q&A. I don't know which one we're supposed to be using. I'm doing a running list of names, by the way, for the book. So I'm getting everybody. And if I could go, Oprah on you and give everybody a book, I would. I will tell you, little known secret, that if you're at a large institution that has a pretty robust subscription to Springer, you can get the book for free through your library services. All right, so we need a hand or a chat. Marie Lusk. Can we give Marie Lusk the mic?
Sorry, I have to find her. I don't see her hand raised. Let's see.
Just look for the good hair. So
Richard, if you can help and find Marie Lusk as well. Oh, there she is. Got it.
Bill Pine did
Hey, Marie.
put something in the chat, and he said there must be a contact listed and there must be timelines. Thank you so much, Will.
Marie, are you able to speak now? I think I unmuted you.
Unmute. Okay. Hello, how are you guys?
Great. How are you doing in the shiny city of Chicago?
Oh, well, we're doing well over here. So it's cold and sunny, but we'll take it. So what should be included in this procedure for grievance policies within ours, because it was so eloquently written and reviewed by some amazing people that are on this call. The procedure in the correct offices identifying, to the student, should they get denied an accommodation, what do they do next? Who do they speak to? What documentation would be required? Clearly, it needs to be posted for prospective students, for current students, faculty, for everyone to see. So it should be listed on the website for all to view. And it should also be an actual policy that the institution has, that it goes through that committee to be vetted as an actual policy, not just something that is just, oh, here's a document from my office versus no, this is an institutional grievance policy from our institution. To just guide the students, so if they are denied, they know what to do to move the process along should they want to challenge that decision.
Awesome, thank you.
And it should be and it should be issued to every student with their original accommodation letter. So they have that.
Yes, we recommend putting it in the actual letter so that it's in every letter, so every student knows about the process regardless. And Joe is sending out some comments. There have been great comments. Again, Nevada for the win. It must be in an accessible format. And sometimes I think we don't think about these things, right? We throw a PDF up on the website, but we don't think about whether or not it's accessible. So thank you. All right, moving on, Charlotte.
Hey. Section 504 of the Rehabilitation Act states that no otherwise qualified person with a disability may be excluded from participation in any program that receives federal funds. What does otherwise qualified mean in the context of your institutional programs? And how do technical standards, if applicable, play a role in determining when a student is otherwise qualified to participate in an educational program?
All right, this otherwise qualified it's a tough one. Who's going to tackle it? Brian, all right.
And if somebody else wants to talk, please take it. But in a nutshell, a person with or without accommodation would have to be able to perform the essential functions of the program. So for example, if the goal is to learn to be a truck driver, you have to qualify for the state license and you have to be able to do the functions of the training. Now, the important thing is they can proceed in the program up until the point that they would hit that area that they could not do without accommodation. So we might have discussions with somebody. For example, this comes up with state licensure a lot, right? If you look at your state licensure for being a nurse, it may say things such as must be able to hear a patient's heartbeat. So we would have that discussion with the students so they would be aware of potential concerns, but we would continue to support and accommodate up until the point that they would hit whatever legitimate barrier was in their place, even if it was outside of our program. I've always said it's much better for them to sue the state than to sue UNLV.
Thank you, Brian. Anybody else?
Lisa, can you put the slide back on question 5?
Oh,
It looked like it may have.
no, thank you. I think my big fat pinky hit it. Appreciate you. Oh, great, Paula.
So I'm actually on faculty in a special education program, but I focus on transition to adulthood. So you guys are also my people. So thank you for allowing me to be here. We, in our department, struggle with the idea, and I don't know if this is just an education thing, but education is really resistant to developing technical standards. And so what happens as a result is you get students who kind of bump up against that hairy place of, is this a professional disposition issue? Is this a disability issue? But because we haven't yet developed that clear measure of like, this is the bar by which we're assessing, it really leaves us vulnerable as a program area because we haven't named those standards to determine whether or not people are otherwise qualified. So it's definitely, I feel for you guys as disability support specialists, because I think it's we as faculty don't always do as well as we need to give you guys the resources you need to support our students and do your job.
Well, thank you. I think I've been super lucky to just work with amazing faculty, but I know that not everybody has that experience and it can be a little bit contentious. I see we have a couple of other hands raised, and I know that one little secret is that Charlotte O'Connor did a lot of work in kind of parsing out some of these responses, and she has an excellent response to this question. So I may ask her to read her response as well. And we may be able to make these available to folks after the book club. But Maria, you have your hand up?
Yeah, I wanted to add a little bit to what the prior person shared about the education program. So, I mean, to address the question, not otherwise qualified is, can you do the academic and technical standards with or without accommodations? What does otherwise qualified mean is just, can you do it? Even with the accommodations, without the accommodations. And I have to agree that one of the departments, and I worked with not just medical students, but all the PhD students and those in graduate and professional training programs, the ones that I have the hardest time with just trying to figure out, well, why is the 4.0 student getting dismissed? Is the education program. They are so resistant to nailing down technical standards. And they just say things like a fit, and I try to guide them towards some of the technical standards we use for the medical education program. Like, how do you define professionalism? And it's so hard to just have them join the table for that conversation. So when we talk about how do technical standards, if applicable, play a role, it's not just can the student do the homework, can they test, but can they do the functions of the profession? And for professional training, I think that is so critical to be able to articulate it and operationalize it. And accommodations can be part of that process, and they usually are with many of the students I work with. But it's hard to provide those accommodations when the discussion on what is it that you actually need the person to be able to do is not happening. So it's definitely a collaborative effort. And when everybody comes to the table, we've never had a challenge.
That's great. That's great. And Paula, I would encourage you and everyone on this call to join the next book club, which is about technical standards. And I'll also take a minute to plug, there was a AAMC webinar about technical standards that's free and accessible to anyone. So if you go to the AAMC website, click on there, I don't know if it's under professional development or something like that, but anyone can access this webinar, and it walks people through how to develop technical standards. And even though this was for medicine, it still is usually the same 5 domains. I will say that another way to address the professionalism / behavioral concerns, Paula, is to put a educational outcome or competency in every single course that is behaviorally or professionally dependent. So student will XYZ, and have that be part of the syllabus for each course. Charlotte, do you want to read you had a quick answer that I think is just a wonderful summary of this?
Really? Well, thank you. To the first question, what does otherwise qualified mean? My note said language was directly from section 504, and the definition depends on the type of program. Otherwise qualified means that the student meets the program's stated criteria for participation and is able to successfully complete coursework. And the second part, how does otherwise qualified play a role, or how do the technical standards play a role? The criteria includes meeting admission standards and maintaining passing grades. Some programs, such as those in the health sciences, have tech standards. Oh, this isn't offering a whole lot more, but, and I said, we will be discussing that more in chapter 3. And in my experience, we've seen in medical education, a lot of the language of the technical standards, it maybe we've changed ours so that it's not depending on sensory ability. So it won't say student may be able to hear a heartbeat. We'll say they may be able to detect a heartbeat. And that is more inclusive of students who need accommodations.
Right. And we are building a pathway of deaf physicians at Michigan that's going to be pretty robust. We've just admitted several deaf students to our medical school again. So we're super excited. And Christine Lowe gave a really nice answer that technical standards are the non-academic criteria. And I think that's really important to remember. You can't throw a bunch of competencies in your technical standards that require an educational piece. These are non-academic criteria. And of course, as with anything, as Brian pointed out, these can be met with or without accommodations. But when you get to the point where there is no accommodation that would not lower the academic rigor or, you know, change the essential functions, but still allow the student to progress in the program, then you've gotten to the point where somebody would not be otherwise qualified because they can't complete the program even with those accommodations. So moving on to question 6, feel free to raise your hand if you have comments, questions. I see a ton of people now. What it's doing in the participants is it is taking all of those people who have spoken or chatted to the top. And so I'm going down the list and I'm seeing a ton of names. And I really encourage you, you don't have to know me to speak up. I really encourage you to if you're comfortable to participate. And I actually am going to point out one person just because the name is so cool. It's Kelly Kelly. And I don't know Kelly Kelly, but I just saw this in here and I just thought it was the coolest name. So I'm curious to know if that is an acquired last name through a partnership or if that is someone whose parents actually named them Kelly Kelly. All right, question 6. Why is it critical to establish and consistently follow a standard procedure for application and determination of accommodations? And then as part of this, what is your school's standard procedure and how is the procedure communicated to students and to faculty to ensure that everybody is aware of the process? And just in case you all were wondering, Kelly Kelly is a married acquired last name and she loves it. So good for you, Kelly Kelly. So anybody want to raise their hand? Why is it critical to have consistency? When we lack consistency, what can happen? Oh, good. Hands raised, hands raised. All right. Who wants to go first? Dina, do you want to go
I
first?
can. Yes, this is Dina. It's critical to establish consistency in application and determination of accommodations because you don't want to show preference for one category or another. And all of the ADA laws, ADA requirements need to be applied equally. So, and it's important for the students to see that. Our procedure is that we have all of our requirements listed on our website. The application is front and center on our website. The information about the process is right there, also accessible in an accessible format. And it's important that both students and faculty are aware of this so that students can apply if they feel they qualify for accommodations, and faculty know how to recommend our services to students. And when talking to faculty, we do a number of presentations to our faculty to make sure they're aware of our process and how to best recommend the Disability Resource Resource Center to some students. And I often tell them it's like recommending the Writing Center or some tutoring that's available on campus. We're a campus resource, just like the Writing Center is a campus resource, just like tutoring is. And it just allows students to make a choice for themselves if they would like to access our services or not.
Great, thank you. And that Christine Lowe, you had a really good comment. Do you want to say it, or do you want me to read it? Can we unmute Christine Lowe?
Let me see if I can find her. Yep. Christine, you should be able to talk.
Hi guys, can you hear me?
Yeah.
So our process is published on our website and it's also in our student handbooks. And then I go to all the program orientations at the beginning of each year. So it's there. It's also in our faculty and staff trainings. And we also got it embedded. Not the process, actually, it's not the process. The availability of DS is also on all both schools' syllabi for every course, if that makes sense.
Great. And so one of the things that I want to bring up about kind of standardizing the process and making it transparent, more to the making it transparent part, is students are afraid. Students, especially health science students, are afraid of the unknown. What does this process entail? Who's going to see my documentation? What's going to happen? How are decisions made? And we really want to reduce that fear as much as possible. As well, and Chris brought this up in the chat, you know, if you're making decisions that are inequitable across students, whether it be students in different programs, students of different races or genders, or students of different disability categories, that's a problem. And having a consistent process will ensure that to some degree that students are, you know, these decisions are adjudicated, you know, in an equivalent manner. It's protective, so that, you know, should a student file a complaint and say, and I've actually been part of this, where a student has said, you know, a determination was race-based versus disability, that other students that were not a minority category that were receiving accommodations had been given more accommodations. So you want to reduce that bias. And everyone has a level of bias, regardless of, you know, what you think. And so reducing it is really important. I think probably the most presenting issue is, you know, having a student that's curmudgeony, right? That you're working with, and they make your life maybe a little bit more complicated and a little bit more taxing. And you know, you want to make sure that the decision that you make for that student is the same for the student who makes your life just a joy to work with that student and be around that student. You want to make sure that all decision-making is grounded in the framework of, you know, the law, and that there would be no question about that decision at the end of the day. All right. And Maria brought up a really good point, right? OCR is more likely to give deference to the institution if you have followed your process. Yeah, Paul says this all the time, Paul Grossman, where, you know, even if you mess up, if you followed the process, even if you didn't get to an answer that the court feels is the most appropriate answer, that following your process is going to keep you from being viewed as discriminatory or retaliatory with the student. So I do think that that is a really important concept. So moving on, I know time just seems to be slipping away from us. So moving on to question 7.
And that's me again, right?
It's you again, Charlotte.
All right, I got so engrossed in this great conversation, truly. Why is the student interview a critical component of the interactive process to determine an appropriate accommodations plan? And who else may need to be involved in the interactive process to determine a reasonable accommodation plan that does not hinder educational objectives?
All right. Anybody want to jump in? How about somebody we haven't heard from yet? Who will be a brave soul to come in? This is more of a, I mean, we gave some reasons in the book, but I think this is something where it's, we all probably have our impression of what the most important reason is for speaking with the student. Oh, great. Lisa and Caitlin. Yay. Thank you guys so much. New voices. So Lisa, do you want to go first? And Joe, if you can unmute them.
Sure. Lisa, see if you can talk now.
Can you hear me now?
Oh, yeah.
Okay. I think one of the most important aspects of the student interview is to hear how they experience their disability in their own words. So whether it's in the context of their housing, whether it's in the context of clinical accommodations or other academic accommodations, what is in their documentation is, certainly from that third-party physician or their medical provider, but how they experience really only comes from them. And so that's my favorite part of the process in the interview, where I get to ask more questions and really understand the impact to them.
Yeah. Absolutely. And I know that there's some discussion in the chat about, the student is the expert in their own experience.
Mhm.
And that's where you're going to get, you may get high level information from the provider, but that kind of nuanced information, especially when the accommodations get a little bit more complex, that's going to come straight from the student and their lived experience. And how they go about operating every day, right? How do they navigate their space every day? So thank you so much. And Caitlin? Joe, is Caitlin unmuted?
Hi, can you hear me?
Yeah, hey Caitlin.
Hi. I pretty much will just echo what Lisa said, but I think the interactive process is important because a person may have the same disability, but it may look very different. Like we may have 5 students that have POTS, but each one has a different functional limitation. It affects them differently. Particularly these chronic conditions, it may be different based on the weather or their stress level or, all these other factors. So it really does require asking the right questions of the student to get the answers you need.
Thank you so much. And there's some really good chat happening in the chat. Laura Riley. Hey, Laura, another one of my UC sisters. How you doing? Joe, can you unmute Laura Riley?
There you go. Can you hear me?
Yeah, how you doing?
Doing all right. How are you doing?
Great.
All right. So in answering the second question, as far as who may need to be involved, I would say, it's not only all about the student, but you also need to talk to the, faculty, preceptors, clinical folks to find out the accommodations that you're thinking about, what's going to be possible in the environment that the student's going to be working in. Because you want to make sure, and what's possible, because you're wanting to reduce the barriers. So you want to find out what's possible, because, obviously you don't want to fundamentally alter anything, but you also want to figure out what's going to be possible in the environment that they're going to be in. So working with those folks as well.
Absolutely. If anybody's taken a training from me or watched a webinar, you know that I talk about the clerkship coordinators. Oh, we have a little kid on the line, it sounds like. The clerkship coordinators are just such important partners in this process. And they know all of the requirements that students have to meet, but they're not doing the educational piece. So that's really nice. And looks like we have more hands raised. Megan Matthews.
George.
Megan,
Hi, can you hear me?
Yep.
Yes.
Okay, cool. So this brings up, we actually just, so I am a new access coordinator overseeing students at health sciences at University of Washington. And we actually just had first of hopefully more to come meetings with our clerkship directors yesterday around what our interactive process is, how we're coming to decisions on accommodations, and wanting to bring them into the process. And the question that kept coming up was, how do we help prepare students ahead of time to know what they're actually going to be doing and like specific clerkships or rotations, so that they know how to ask for accommodations? Because I think what we're getting.
I think maybe George muted his mom. But yes, working. So all of you,
okay. Yeah.
So yeah, that's a good point. And I think, one of the things that I really encourage DS providers to do, and this is a little bit off topic, but I think it's noteworthy, is to go to those course coordinators or course directors of whatever health science program you're in and ask them for their checklist. Ask them for what students are going to be asked to do. So whether that's a procedural skills checklist or a checklist of competencies that include, the cognitive competencies or the procedural competencies, things that they have to perform, things that they have to observe, and just get some clarity around the requirements for those, so that when you're engaging with those health science students, you do know that, and you don't have to constantly go back and forth. You're able to, feel really good about saying, these are the things that have to be done. And then you're in an accommodations based frame of mind versus a kind of reaction and going to the program for every question. You can then go to the program kind of in an informed manner where you're saying, okay, these are the procedural competencies that are required for, let's just say, OBGYN. I'm trying not to pick on surgery. Surgery always gets the bad rap, but OBGYN, and this student has a functional limitation that impairs, maybe it's fine motor skills, and here's what we've thought about would be a great accommodation for this specific procedural skill. And then you're arriving at a different level of conversation right off the bat. It's not, hey, what do you think? Versus, because these people are not experts in disability, and they also may not be as creative or thinking outside of the box. I actually think the most creative things come from working together, but I definitely encourage you to get those checklists, and recognizing that we only have 5 minutes left and we have one question left. Define a temporary disability and define a short-term basis. What I'm going to do, since we have 5 minutes left, and I think everybody's pretty well educated in this area, I will leave this question to just sit here, unfortunately unanswered, but I'll try to get Charlotte to share her lovely notes. And I just want to go over a few things with you before the next book club. The next one is on technical standards. That is a brand new chapter in our book. Brand new, wasn't in the last one, written by Elisa Laird. And she's going to offer some great advice, she and John McGaugh. And I think everyone should be signing up. On the website, we allowed you to sign up for individual chapters, thinking that people might be more interested in one chapter over another. And I really apologize for the additional labor that it involves, and, signing up individually for each session. But I hope you'll understand the background for that. And so, Charlotte, why don't you bring us home?
All right. Well, we have covered a ton of ground, and I can't believe how much I learned. So thank you for all the participants. And this was great. Thanks for joining us and participating. And just as a reminder, there's a meeting every month through November 2021 covering the remaining chapters of the book. On this slide, you can see the bit.ly address of the book club. And from here, you can register for all the future meetings. You can also see the facilitators of each chapter and the questions if you want to get a little head start. And Lisa, do you want to talk about the book?
Sure. So as you probably are already aware, we do not make any money on the book. So none of the authors were compensated for the book. The proceeds from sales of the book go directly back into the coalition and AHEAD funds to continue to bring you free and accessible resources for professional development. And that is, it is a labor of love for all of the authors. And we're so appreciative for their time, but we all believe in this work and want to move this area forward. You can purchase the book and save 25% plus free shipping if you use this code bookclub25 at springerpub.com. As I mentioned before, for those of you from large universities, especially those with a health science program, you may have access to the book through your library system. So check with your librarian and see if indeed you do. Usually when you do, it's by chapter. So if you want to just go into your library system and put in the title of one of the chapters or put in one of the authors, you could see very quickly if you have access to that. For those of you that might want to conduct some trainings on your campus, and I know the coalition is going to start working on some training packages that you can take away, and you want to do bulk purchases, this makes a great gift if you have some funds left over. Which is kind of a joke, right? Nobody has funds left over. But if you happen to have funds left over some year and you want to purchase 10 or more copies and give them to your programs, this is really helpful to get them on board. For some reason, health science faculty, when something's published, it has a lot more punch. I believe the discount for 10 plus copies is 40% and free shipping. So pretty sizable. And I think we have 1 minute for questions, which is absolutely ridiculous. But if there are any burning questions that anyone wants to ask before we bid you a wonderful weekend, any hands raised? Well, thank you all for attending. It's so nice to see so many names of people that I've met in different areas, old friends, and all of you that I don't know, you are new friends. It's lovely to meet you. You will unfortunately be subjected to my voice again. I think I'm doing 3 of the 11 webinars, but we really appreciate your participation and encourage you to share this information with anybody. And thanks for showing up and thanks for participating. We're glad you're out there and thank you for the wonderful work that you do.
Lisa, before we go, when will you be drawing for the free book and how will we find out?
Yes, that will be at the last the last month. So I think that's October.
Okay.
So it'll be in the last month. Yeah.
Perfect.
I would have
Thank
loved
you.
to have done 1 per session, but so yeah, it'll be at the last one.
Okay, thank you.
You're welcome. Merci, Laura Bulk.